Thank you so much for joining, Whitney. As you know, my name is Gabriel, and I work for the Office for Inclusivity and Change at UCT. And this is part of a component we called HIV and Me, building kind of a brave healthcare profession. And we're really happy to have you join and to share some of your insights today. And to start, maybe, do you want to just introduce yourself and share a little bit about the work that you do?
Okay, thank you so much for having me, Gabriel. So yes, yeah, I'm Whitney Booysen, and I am the executive director of an organization called Trans Wellness Project. So the Trans Wellness Project is an organization that works in a holistic way with issues facing trans and gender diverse people in the rural areas of South Africa. So we have been in existence since 2005, and we do various work, including HIV work in 5 provinces in South Africa, which is in the Western Cape, the Northern Cape, Gauteng, Free State, and Northwest.
Great, that's really amazing. And so I want to ask three kind of follow-up questions. So the folks who are going to be watching this video are first year students, and so they might not understand some of the words that we're using. So when we use the word trans, what do you mean by trans?
Okay, trans people or transgender people, which is the general term that people use, are people that are not complying or not that are not fine with this with the sex that or the gender that is given for them according to the sexual characteristics that they were born with. So, like for instance, you will get a person that was born with a penis, which a society will immediately assume will be a man. But when the person grow up, the person don't identify as a boy or as a man, or started doing that is more likely to go into the other gender, which is then female. So then that person will immediately identify or have an identity that are more female, and that will be then a trans female. And then for trans men it's just vice versa for person that was born with a vagina. So yeah, broadly, trans people are not people that identify or that correspondent with the sex traits that are given to them as birth. And sometimes these people are more likely to search for medical assistance in order for their physical experience to identify or to correspond with their, like how I called it normally, with their mental or psychological appearance. And then you go into the role where you try to say that this persons are more a transsexual person, but all of that. And then you get gender diverse people that are people that are likely to move into the two genders, which is male and female, or that are not identify as either male or either female, or they have a broader or other identity than just male and female, is how society sees us.
Sure. Thank you so much for providing that overview. And I think what I'm hearing is that we often come in with kind of assumptions and norms about gender, and these assumptions and norms about gender are quite problematic, and we need to reflect on them, especially as young people and as young people who are going to be working in the health professions as well. I guess the second thing I wanted to ask about is you mentioned your organization focuses on work in rural areas, particularly trans people in rural areas. Do you want to share a little bit about the different experiences people in a city might have from people in a rural area and why it's important to focus on rural areas?
Gabriel, and for the people that is going to watch this, is there is a big difference. There is a big dividing, if I can call it like that, with people that are in the cities and people that are in the rural areas. Because sometimes, or most of the cases, is people in the rural areas are not really part of programmings and of research that is done. So their voices are not heard. And what Trans Wellness Project wants to do is we want to cross that bridge between the information and the programming projects that is done for trans and gender diverse people in the rural areas and into the cities. Because now there is a broadly understanding that people in the rural areas, there is no trans people in the rural areas, and I mean, please. Yeah, I am sitting. So people don't know that there are trans people, or people that make policymakers are not people that understand or know that there are people in rural areas, because the programmings don't get to them, because most of the organization works with trans people and work with the rights of trans people, and they for them it's too far, because the traveling distance are too far for people to reach, and most of the time they don't have the funding and they don't have the human resources in order to reach out to people in the rural areas, and that is what Trans Wellness Project wants to bridge, is that there must not be a dividing between people in the rural areas and people in the cities. People's experience in the rural areas, most of them are similar as the people in the cities. We are all facing discrimination. We are all facing hate crimes. That's the thing. But information are not coming to the rural areas. And I also think that people in the rural areas tend to don't understand what transgenderism is, or what they don't understand gender. They only see male and female, and that's where they come. That's where it ends. So people in the rural areas don't understand transgenderism. They don't even, in some cases, they don't understand gay. So they don't know the difference between sexual orientation and gender identity, and they don't know how the two links to each other. So, and even the trans person themselves, for them is they are still struggling to identify with who they really are, because the only word that is prominent in the rural areas are the word morphine, and we know that is a very deroticating word to use towards a person. So it's normally used in order to combat hate onto a person. So, and even in the health settings now, it's very different, because a trans person can't go to the clinics, for instance, or to their local hospitals and say, this is how I identify, and I need this. This is the service that I need in order for me, especially when it comes to trans-specific healthcare services. It's very difficult for them to assist these kind of services, because even our doctors, our medical professionals, they don't understand that. If I can make an example of myself, a few years ago, it was way back in 2009, 2010. 2009, 2010, when I wanted to start my medical transitioning process. And when I go to a medical professional, both the sister that assisted me at that time and the doctor, they told me, but this is something new for us. We don't understand it, and we don't know how to assist you. And now it's 2021. I'm working with a group of people now. I need to travel. As from last year, we need to take out money to let people travel to the cities in order to start this very necessary medical intervention on their bodies. So yes, people, there is a big lack of resources, a big lack of information. That is, the cities are more advanced when it comes to these kind of issues. I recently have a case where one of the girls have a very transphobic incident in one of our clinics. And people in the rural areas are so used to do their work in a certain way. And there is this notion that when people are wearing a kind of a uniform, that they are the the alpha and omega of the people. It goes with our healthcare professionals, it goes with our police, people that works for departments. So, and especially in the healthcare system, and we are so tired of fighting for these people, because we are here, we're not going anywhere. We need the services. And the services that you give is not something that is extra that you need to do. It is based on and it's part of our daily human rights. You can give the services. But the challenge that we face is, you can't go to the clinic and say, I want to start my medical transitioning, because they will tell you, we don't know how to do that. And for Trans Wellness Project, I have next week I have a session with the healthcare professions, and to hear from them is, what are your challenges apart from not knowing? Because I mean, seriously, it's 2021. By now, you know that. You know the services can be available. So what is the challenges? Why can't you give these kind of services? Because the services are at the clinics. They can give it. The medication are there. like if you take for operations, like normal operations, like basic operations, like orchidectomies, it's done every day by our medical professionals, like giving a woman that are on menopause to give them hormones. The services are at the clinic, but when it comes to trans people, which are basically the same services that they give to some cisgender people, it can't be given. And that is a challenge that we are facing, a big challenge. And it's part of the way of taking away our basic human rights when it comes to the rural areas of South Africa.
Sure. Yeah, thank you
That
so
was a
much for that really
mouthful.
powerful reflection, Whitney. But I think you're highlighting some of the unique challenges that people in rural areas would face, particularly around access to healthcare, getting healthcare professionals that understand their needs and can, provide sensitive services, and also dealing with everyday forms of discrimination and harassment and stigmatization as well. Thank you for that. And I guess the next question I wanted to ask is part of what we're trying to explore in this component is the intersection between HIV and the experience of marginalized groups. And I guess in this case, the trans community. What are some of the challenges in terms of accessing HIV care and also maybe HIV stigma?
You know, Gabriel, this is a very, very important question and a very, very important and kind of difficult question that you ask. Because, like I said earlier on, is one of the women that I'm working with was facing now recently a case where it comes to HIV testing. So, our primary healthcare systems nowadays have this thing there where they need to have a certain numbers that they need to tick off the people that they test for HIV. And I'm just making this example now in order to come to effect on how discriminatory our healthcare systems currently are in 2021. It is. And because, so she goes, because she have a challenge with her tonsils. So she goes to the clinic and they get a file. And the next thing, what happens was she went into observation, and the next thing is, while she's waiting for the sister to see her, the counselor of the clinic called her. The counselor didn't give her any information about why she is there. She didn't get counseling. She just needed to sign a form, and they tested her for HIV. And when she requested on, why do you test me for HIV? Because I didn't ask for that. The counselor just say, it's just because to make sure that you are clean. I'm making this example because this is the challenge that we went through in the rural areas. People tends to think, or when you are identify in terms of sexual orientation and gender identity different to what they knows or what they perceives to be is, there is so much discrimination. They all see us as the drivers of HIV. And there's that word of key populations that is, and I'm so glad that you use the word marginalized groups and not key populations, because at a point I'm getting frustrated with the word key populations, because it means like I have a key to a certain thing. So in this instance is I have a key to HIV. We all have a keys to HIV. We understand that. But when it comes to trans people or gender diverse people per se, is we are seen as the drivers of HIV, which is in most cases not the situation. And our clinics don't understand that when you go to the clinic, we are human beings. We have other illnesses that needs medical intervention in our bodies. And HIV, we all see, when you go there, it might be, oh, that is an HIV person because it's obvious a trans person, so the person might be HIV positive. So it's difficult in terms of how our clinic systems currently are at. There is no safety. There is no, you are, it's like they call you in front of everyone for HIV services. The one counselor once told the one trans girl in front of the whole clinic, when are you coming for your CD4 count? You have to come for CD4 count. Like confidentiality is an issue at our clinic. So, but overall, the clinic is very discriminating when it comes to trans people in HIV per se.
Yeah, no, your answer was really great and really useful. I think you framed the different ways discrimination really plays out within that space. and how issues around confidentiality and just respect and dignity is a huge challenge for trans people trying to access HIV care. I guess the next question shifts the tone a little bit. So, knowing these challenges, what do you
Mhm.
think are some of the roles or responsibilities, or maybe even positive behaviors that healthcare professionals need to take on within this context? So, what are some of the roles and responsibilities then of healthcare workers, in your opinion?
You know, Gabriel, from my point of view, as a person working so long with the struggle, and you have these challenges with the clinics, specifically with Department of Health or with healthcare professionals, I think they need to understand that we are people and they need to treat us with respect and dignity, first of all. Because if you treat somebody with respect and dignity, you will do your work better, first of all. I have a conversation with one of the sisters, and I told her, and she told me but that she have not only when it comes to trans people, but she have a lot of challenges when it with her staff. And I said, listen, you have to sit with your staff and you have to ask them one important question: Are you here to make money, or are you here for the love of your work? And they have to answer that question very honestly. If they are not there because they have a passion to do the work, then they must go and go sweep the streets at the municipality, because then they will do a much better job. But going to a clinic or to a primary health care system, and you go already with an attitude on how you're going, because you are the sister, you are the nurse, you are the counselor, that needs to stop. All of them signed confidentiality clause. All of them signed the Florence Nightingale form that they promise that the person standing in front of them, they will give to that person the best service that they can give. And when they say the best services, it's a service that is non-discriminatory. It's a service that goes apart with respect. And that's all that we expect from them. I also think that when it comes to trans people, specifically, our healthcare systems in our rural areas needs to up their game. They can't keep on, especially when it comes to trans healthcare services. They can't keep on telling our people that we can't give you the services because we don't know how. I mean, like, the internet is there. If you don't understand, there's organizations, and they all know about trans wellness project. There's all organizations. Reach out to organizations and ask questions. I don't think anybody is going to die to ask a question if you don't know something. But they already have this. They think that we are loading more to their jobs and or is what they already do, and which is not the cases. We are there to work with them because we know the struggle. We know how hard it is, not only for us but also for them. So I think, like, their behavior towards people in general first needs to change, and they needs to give people non-discriminatory services in the healthcare systems. If they don't know, research, ask questions. That is the other thing, is ask questions. If I'm sitting right in front of you and you don't know how to address me, ask me. Tell me, listen, I'm very confused. I don't want to discriminate against you, but how do you want me to address you? Do I address you as ma'am? Do I address you as sir? Or how do I address you? Ask and have a consent. But also, what you know how our clinic systems are. A certain day is for a certain illness. I think that needs to stop because this is internal discrimination. Because a certain day, certain people needs to go and see a certain sister for a certain sickness. So on that day, if a trans person goes there, and it's, say for instance, it's HIV day, you by now you know what how the files are looking. People know how the files are looking. If your file have a certain color code on, they know that file is for HIV. If a certain sister call you, they know that sister doing HIV work. And I think really Department of Health should up their game. We are too long in this fight that we still struggling with discrimination in our public health care systems. But I think really people should have a more positive attitude when it comes to people, especially trans people in healthcare facilities. And I also think that is where it should begin, is treat people with dignity and respect. Forget about your culture, forget about your religion, forget about your skin color, forget about how privileged you are, and attend to the needs of the person standing or sitting right in front of you.
Thank you so much. That's a really powerful reflection, Whitney. I really appreciate that.
So much.
Our time is almost up, and I just had one kind of closing question. And the closing question was, if you're thinking about the young people who are watching this video, are there any aspects you would advise them to self-reflect on? So when young people are thinking about, responding to the needs of trans people or providing better HIV care, what would be some of your suggestions or tips for them? What should they be thinking about or self-reflecting on?
Like I said earlier on, is educate yourself, do research, make Google your friend. The internet is most of the times friendly to each and everyone. There is a lot of information on the internet. There are organizations that do amazing work. Contact the people. If you know about a trans person, ask the person, meet up with the person, ask the person, what are your challenges? How do you think I, as a healthcare professional, can make the work better for you? How can I better up my game? Don't think that you know all, because every day things are evolving. So yes, yeah, do research, up your game, ask questions, get in contact and hear what is the life experience. Because my life experience of somebody sitting in Lutzville and the life experience of somebody sitting in Cape Town are very, very different. And there is a understanding that if you see one trans person, the other trans person struggles are the same. So don't assume, don't make assumptions, because I don't want to use this word now. There's a saying that says that assumptions are the motherfucker of everything that goes wrong in our society. So don't make assumptions. Don't act as if you know all. Don't act as the holy person or God over other people's bodies. Ask questions, connect with people and interact with people in order for you to give a better service. I know that it's long years that people are studying. It's a lot of money that they get out of studying. But the things that you learn in the book are just giving you the basics. When you start doing the practical work on the ground, that is where your struggles are going to begin. And I think that most of the things we can avoid, but by just being friendly, non-discriminating, and respectful to each other.
Yeah, that's so great. Thank you so much for that, Whitney.